Hi. Today I'm going to talk about St. John's wort. St. John's wort is a handy little plant to have around. It is a nervine herb. Nervines nourish, regulate, strengthen, and rehabilitate nerve cells, and they function as nerve tonics, which means that you can take them for long periods of time to help with nerve problems. Its main active constituents are hypericin and pseudohypericin, which give it its antidepressive and antiviral properties. Therapeutic actions of St. John's wort is that it's an antibacterial, antidepressive, anti-genotoxic, anti-inflammatory, antiviral, astringent, sedative. It's a vulnerary herb, analgesic, antimicrobial, and an antifungal. It has many medicinal uses. There are many. Um, it's used for anxiety, cell damage, depression, duodenal ulcers, dyspepsia, fibrositis, first degree burns, gastric ulcers, herpes, infections, myalgia, nervous unrest, myalgia, sciatica, skin inflammation, and wounds. Um, I have this picture here because these flowers they turn red. When you touch them and you squish the petals or the flower top, um, it leaves a red pigment on your hands. So when you infuse the flowers in an oil, it turns the oil red. And we'll talk a little bit later about what you can use it for. But some more medicinal uses of St. John's wort are shingles, chickenpox, cold sores, fibromyalgia, cystitis, dysentery, intestinal parasites, dermatitis, bedwetting, hemorrhage, discharges, irritability, sunburn, rheumatic pain, varicose veins, hemorrhoids, facial neuralgia after dental extractions, and toothaches, and how it is used. So the essential oil is used for anxiety and depression. Um, and it can be used like if you mix some of the oil with the base oil, it can also be used topically for wound care and stuff like that also. Um, and the infused oil, which is like the bottle that I showed you previously, is used for blunt wounds, bruises, first degree burns, fibrositis, injuries, myalgia and sciatica, dermatitis, and shingles, chickenpox too. The infusions used for shingles, chickenpox, menopausal nervousness, nervous unrest, ulcers, um, and the fluid extract and the tincture are also used for anxiety, depression, menopausal nervousness, nervous unrest, and ulcers too, um, and fibromyalgia. The energetics of St. John's wort is that it is a somewhat bitter, sweet herb. It's astringent, cool, dry, relaxing, restoring, and stimulating. Side effects of St. John's wort. Um, Sometimes there's rare photosensitivity in large doses, which means that if you're taking higher quantities of St. John's wort, you'd want to stay out of the sun as much because it causes photosensitization. Um, Another rare side effect is increased sensitivity to heat, cold, and pain in the hands, emotional vulnerability, fatigue, pruritus, and weight gain. Um, every herb affects every individual differently, so something that might work for someone else may not work for you. Um, So that's with any herb. So, like I might be able to take it and be like, oh, this works so great for me. And you might take it and you may have some side effects or you it may not make you feel the way you want to feel. And so it's good and important when you're taking herbs to feel the energy that you feel when you're taking them. And if that herb doesn't work, then you go to another one that has the same therapeutic actions and medicinal uses, and you try a different one. Contraindications is St. John's wort is not used for psychosis or severe depression. So don't use it for anyone that is having any sort of psychosis or severe depression. Avoid excess sunlight again because it is can cause photosensitivity in sunlight or UVA light exposure, especially in fair-skinned individuals that are taking high doses. And avoid using with anything containing tyramine, alcohol, tyrosine, narcotics, amphetamines, and over-the-counter cold and flu remedies. And use caution if there's a history of mania or hypomania, like bipolar, because hyperism can cause hyperism-induced manic episodes in someone who is already having a mania issue or a hypomania disorder. It does have interactions with medications. Don't take it with other drugs. If you're taking a medication that causes photosensitivity, if that is also a side effect of that, don't take this with it because it's going to increase that photosensitization. It increases the liver's cytochrome P450 detoxification system, which causes it to increase the breakdown of other drugs, and it can reduce intestinal uptake of some other drugs. So also don't take it with other herbs that are photosynthesizing, and essential oils. So if you say, for instance, you're using bergamot and it has bergaptine in it, because the full spectrum essential oil of bergamot would have bergaptine in it, which is what causes the photosensitization. So don't use it with other oils that cause photosensitivity. Do not take with warfarin as it decreases its therapeutic effect, and it should not be taken concurrently with oral contraceptives. So if you're taking oral contraceptives, it can reduce the uptake of those drugs. And so if you might want to check into that or change the contraceptives that you're using. So that would be something like the birth control pill. If you're taking the birth control pill, this will make it not work. Do not take concurrently with cardiac glycoside herbs, as it can reduce therapeutic effects, such as digitalis. And don't take it with other glycoside medications either. So because of the metabolizing via the cytochrome P450, you have to take caution if you take things for heart disease, seizures, cancers, if you use non-nucleoside reverse transcriptase inhibitors, drugs to prevent transplant rejection, and some antidepressants it can cause issues with. All right. And that concludes our little talk on St. John's wort. Otherwise, I think St. John's wort is a great herb. It's a great herb for many things. My references. And thank you for watching the video. My name is Ashley Carpenter with Outlandish Remedies. I'm an herbalist and an aromatherapist. And yeah, thanks for joining in.